Hi YouTubers, livers, and bariatric community in general. How are you today? My name is Yomara and I am here to share my journey through bariatric surgery. Today I will give you all my stats and a little bit of what's been going on with my process. I'm 5'3" and my highest recorded weight was 223 pounds, and that was back in December after I stopped smoking and gained weight. At the beginning of the process I was 201 pounds. Reason why my primary care physician decided for me to have bariatric surgery is because I do have sleep apnea, metabolic syndrome, high blood pressure, and borderline diabetic. So I do have a lot of comorbid illnesses that make me a time bomb. And at this point, I'm too young to die. So we decided that the best route at this point after to try bariatric surgery. So I am having surgery the 2nd of September of 2015 at the North Shore Bariatric Center in Salem with Dr. Jaime Rivera. I can wait. The 19th of August, I will start my pre-op diet and I will vlog the whole thing. I will need a lot of support and I will really appreciate if you guys can help. I know some of you have been through it, some of you are getting to it, and I will try to give my all to anybody that needed my help. So first thing, when I started my journey back in September last year, to go through several tests that they are required for bariatric surgery in general. And that was even before I decided which of the surgeries I was going to have. So I met with my surgeon, Dr. Rivera, and he explained to me that I had to go to a upper GI, which is test that will see how the liquids go down through my tract and to see if there was any spotting or anything. And also I would have to go for an endoscopy. I was like, why both? But yes, it's needed because they need to make sure that anything within your digestive system, the upper part of your digestive system, which is your tracheas and your esophagus and the little flap here that can be like a herniated, in your stomach, are very well to undergo surgery. So my first test, I had it like a week or so later, which it was the upper GI. In November 18th of last year, I went for my endoscopy. After that, I did all the tests. They test you for any kind of drugs, any kind of trace of alcohol and trace of tobacco. When I started the process, I used to be a smoker. I did stop smoking. That was more than enough for me, finally, to stop smoking. So I did. And then one of the biggest reasons why I wanted to do the videos and I wanted to share my journey, it was because nobody told me that when you get at least 20 pounds. I know that, yeah, you gain weight, but I thought that because I was watching, what I was eating and whatnot, it wasn't going to happen. Big mistake. Please, if you are trying to get bariatric surgery and you do smoke, and you're going to cessate smoking, please make sure you soil your jaws or you get into a very, very strict diet, because you will gain weight. And not 1, 2, 3 pounds. No, it's not a joke. You'll get up to 20 pounds. So please be advised. Like, that's my advice. Because of insurance, careful, be warned. Also, one other thing that I have investigated about bariatric centers throughout the country, most of the programs, including programs in Mexico, they are related to doctors here in the US, do require that the patient had not taken any kind of recreational drugs like marijuana or cocaine or heroin or any of those things for at least 18 months, that has not drink for at least 9 months, and then is tobacco free for at least 3 months. So please, if you are planning on bariatric surgery as well, be aware that you will have to stop smoking. You cannot drink while you're in the process, and of course you cannot do any kind of drugs. Okay, so after those tests, they also check anything on my blood that could cause any problems for my surgery. Everything and anything they can find in blood, they test it. We also start seeing a nutritionist. I was seeing a nutritionist on a weekly basis up until 2 weeks ago, when I finally was put through. I had to battle for 7 months with 20 pounds that I needed to go down in order for me to be able to be put through. Because of the insurances, they will not put you through if you gain weight throughout the process. There is also a very, very, very rigorous mental test. They will test you to make sure that mentally you are capable of dealing with what this surgery is. There's a lot of people out there that had the misconception that bariatric surgery is the easiest way. No, it's not. This has been a very long journey to me so far, and still it's gonna get worse after surgery, when I had to deal with what happened then. But before surgery, I've been dealing with this program for a whole year, and I've been committed since day one. I stopped smoking without patches, without any kind of help. I said, I'm not gonna smoke anymore, and I did. So that's how committed I am to this program. So make sure that you find the guidelines of your insurance first and foremost, because a lot of insurance have different guidelines. Some insurance was 6 months cost program where you will have to lose a certain amount of weight. Some they're 20 pounds, some they're 30 pounds, some is like just show that you're losing weight, so on and so forth. But make sure that first thing, try to find the best bariatric center that is more recognized around your area, and how your insurance will cover for it. That is the two first things. And then that no alcohol, no tobacco, no drugs, also that's very important as well. If they see that you cannot comply with the weight loss for whatever reason, they will have you see a therapist. Because I was battling with those 20 pounds and it was so hard for me to walk. It's hard for me to exercise. It's hard for me to be on my feet for 2 long periods of time. So it was really, really, really hard for me to lose the weight. And I will lose 5 pounds and then I will gain 2. So on and so forth. So my advice to everybody at this point about the doctors, they're all in the internet. You can check them. Don't go to just anybody just because. And don't go to the easiest program either. Things that come easy usually are not the best. So I am very glad that I actually chose the program that I am, because they have been very thorough. I have learned a lot. It has been very, very educational. I thank one more time YouTube and the whole bariatric community. You guys are wonderful. You guys are exceptional. Thank you for sharing your journeys. Thank you for showing people like me, newbies, that it is possible, that it is doable, that you guys are doing it. And thank you also for letting me share my journey here with you guys. And I hope that everything that I do here is to help and assist other people. And so I will vlog every single day when I start my pre-op diet. I know that I'm gonna need help, and I choose you guys to do so. So thank you, and I'll be back very shortly. Bye.